Hello and welcome. I'm Dr. Keith Lynch. I've been in private practice here in Central Virginia since 1998, and today we're going to talk about my approach to headaches, facial pain, and TMJ dysfunction. Now, when talking about that, we need to know how sensation comes from the face and scalp to the rest of the brain where it actually gets perceived as pain, because prior to that, it's just electrical signals. So if you have problems along the face area, you have your ophthalmic branch, your maxillary branch, and your mandibular branch of your trigeminal nerve. So that fifth cranial nerve comes out right behind that jaw area and sends sensory nerves out to that face. Cranial nerve 5 is also what sends nerves, motor nerves, to the muscles of mastication or chewing and speaking. And then the back of the skull and underneath the chin around the neck are the nerves of the upper portion of the neck. So that's where the sensory portion comes from that goes to this area. Now, because we're talking about the cranial nerves, cranial nerve 5 in particular, and cranial nerve 7 we'll talk about later, we need to talk about the blood supply and how it gets to them, because that's part of the story of what we're looking at here. So there's a lot going on in this picture. What I really want you to focus on is this vertebral artery as it comes off of right here. It enters into the bottom of C6, and from C6, 5, 4, all the way up through C1, there's a hole in the side of the bone on each side of the neck that blood supply goes to as it makes it up to the brain. And then when it gets up to the base of the skull, that vertebral artery is what goes to that brainstem area. And that's the important takeaway on this, is what can happen here, because what we're talking about is addressing neurovascular compression of the brainstem area by the vertebra in the neck and the atlas. So this picture here just shows you the overall, this is what the brain looks like, and then this is the brainstem right here. So when we go to the next slide, that's what we're really looking at, and you're seeing more than just the brainstem. So kind of think of it as, this is the mesencephalon of the brainstem, this is the pons, and this is the medulla. So it's got 3 floors to it. On the top story of that brainstem, we have your mesencephalon. That's cranial nerves 3 and 4, the oculomotor and the trochlear nerves. They have to do with eye movements, moving the eyes around. But at that same part of the brainstem, we also have your superior and inferior colliculus. These are the areas that sight and sound go to. So if you're one of those people that gets headaches, and bright lights bother you or loud noises bother you, you may have an overfiring mesencephalon, and we'll need to address that. It also has to do with dopamine production. Dopamine production helps with pain. It happens in the substantia nigra pars compacta portion of that mesencephalon area. So we want to know how well that area is working. When I say an area is overfiring, that means those neurons or nerve bodies fire fast and fail fast. And that's what we'd be looking for due to a lack of blood and oxygen and nutrients getting up to that mesencephalon. Now we also have the pons. Now the pons is important because the facial nerve nuclei are going to live there. Cranial nerve 5, the trigeminal, 6, the abducens, 7, the facial nerve, and part of 8, the vestibulocochlear nerve, will also be involved here. So cranial nerve 5 is sensation to the face, motor to the jaw. Cranial nerve 6 goes to the eye for internal lateral abduction. Cranial nerve 7 goes to the muscles of facial expression. So that can also be involved with people with tension, headaches, and facial pain, as well as taste to the anterior 2/3 of the tongue. And then cranial nerve 8 has to do with hearing and balance. Now the lowest floor of this brainstem area is our medulla, right before it becomes the spinal cord. And cranial nerve 9 has to do with motor and sensory function for swallowing and speech. That's your glossopharyngeal nerve. Cranial nerve 10 is your vagus nerve. Now that's an important one because it has to do with parasympathetic activity. So digestive function, heart function, all is controlled by cranial nerve 10, which exits from the medulla down here. There's a nerve on each side running right down in front of that cervical spine and that atlas bone that controls from the roof of the mouth down to the belly button for all your parasympathetic activity. I like to think of parasympathetic activity as automatic activity. So that's your heart rate, digestion, blood pressure, respiration. All that's controlled by your vagus nerve through your parasympathetic nervous system. And then cranial nerve 12 is motor to the tongue. It's your hypoglossal nerve. Cranial nerve 11 is not listed on here because it's the spinal accessory nerve. It's not truly a cranial nerve and isn't really part of what we're talking about in this. Now we talked about the atlas vertebra. The atlas vertebra is C1 in your neck. It's the very top bone there. Not only does it have the brain stem coming down into it with the spinal cord there, but that's where that vertebral artery goes up into the brain. And as it does it here, you'll see that the atlas, or C1, has these little wings that stick out on the side of it. That's important to note because that vertebral artery is coming up real close inside the spine on the edge of those bones. And then when it gets up to C2, it makes a 90-degree turn. And then it makes another 90-degree turn as it goes up through those transverse processes, and then it makes another 90-degree turn, and then another one as it goes up into the skull. So there's a lot of this going on with that vertebra, with that vertebral artery going through that bone. So if that bone is rotated out of position, it's going to take all the slack out of that vertebral artery, making it more susceptible to having problems. Now, this is not the same situation as saying it's like a garden hose. If you step on it, there's going to be less information or water going through it. In this situation, the way these arteries work is they have smooth muscle on the inside of them. So anytime they get irritated, it can cause that intima, that wall on the inside of that artery, to start to shudder, and it's going to decrease the size of the lumen or gauge, and you will get less blood flow through there, which is going to translate to less blood, oxygen, and nutrients getting to that brainstem level. The other thing that can happen is you can actually have such a misalignment that it literally presses on the brainstem itself. We just talked about all the important functions that that brainstem has. So those are the things that we're going to be looking at to address in order to correct problems with head pain, facial pain, and TMJ pain. This is once again showing that first picture, showing our ophthalmic, our maxillary, and our mandibular branches of that trigeminal nerve or fifth cranial nerve. What this is trying to show us is that sensation that comes in from the left side of the face comes in, and it's going to go to a ganglion right here, and then it's going to pass down in through the spine to the levels of C5, and then it crosses over, and then it goes up to the other side of the brain. We all know through strokes that if one side of the brain is affected, it's going to affect the other side of the body. That holds true even in the head and face region. So once again, you could have a problem with a misalignment of vertebra or a disc in your neck that can be causing both headaches as well as TMJ and or facial pain. Our approach is unique because we're going to address the atlas area. When we do that, we're looking for a misalignment of that top vertebra, putting a neurovascular compression at that brainstem level. If we find it, we use a specific instrument adjustment that sets that bone back to its proper position, taking the pressure off those nerves and blood vessels. But not only do we do that, we also do instrument adjusting, which means it's a handheld adjusting instrument that we use to correct any misalignments through that neck area. So we're never doing any twisting, popping, or cracking. It's very gentle, it's very precise in the way it's performed, because the blood vessels coming up through the neck start at C6 going all the way up into the skull, so we could have misalignments of vertebra and or discs lower down that can be affecting that flow of information and blood and oxygen up to that brain stem. We also use cold laser. Now, cold laser can be very effective to improving circulation, reducing pain, and helping nerves work better. That's one of the main things that we use cold laser for, and it works great with head pain, with TMJ pain, with getting the muscles in the jaw to start working properly again. It's all very important that it goes together and everything gets checked. And then sometimes there can be scar tissue that develops in the jaw or in the neck area that needs to get addressed. And we do that with our percussion instrument. Now, a percussion instrument is going to feel like a massaging type tool, but literally it's a hammer. And we use that to break up scar tissue adhesions. Now, scar tissue forms because of misalignments and repetitive stress to areas. So the outside covering of a muscle has what's called a glycoprotein or a sugar protein called fascia on the outside of it. Over time, that fascia can break down and those sugar proteins or glycoproteins can stick together or adhere. Well, that's what produces the scar tissue that can pull on nerves and blood vessels that can cause a lot of these problems, or they can cause the jaw to not hang at the right angle, or cause a problem in the neck where the neck won't go back to its proper position. So we're addressing all of these areas to make sure that we've got everything working as best as possible. Now, because you've watched this video, my offer to you is this. What I'll do is I'll sit down with you and take a history, and we'll go through how your condition started, what things that you may have tried, what things that or activities that you do now that seem to make it better, what makes it worse. We're going to try to really understand what's going on with your condition so that we can pinpoint our examination with our orthopedic and neurological tests to find out exactly which areas are involved and what needs to be addressed to get those areas working better again. We'll take any necessary films, and after I do all that, I'll give you a written report of what I've found and what I'm recommending, right down to how often do you need to be here, how much is it going to cost, how much of it is in your insurance going to cover, everything, all the whole ball of wax. I'll have that written out before we do any treatment so that you can look at that and say, yeah, this is what I need to do, and then we can get started. I'll do all that for $77. These services normally cost $249. Heck, if I took 2 x-rays, that would cost $80 right there, which would be more than this. So I'm making this offer to you so that it's nice and low so that you have the opportunity to come in, get a second opinion on what could be causing your TMJ pain or your facial or head pains so that we can talk about it together and come up with a plan. Now this offer does not include federal beneficiaries. So what you need to do is call our office and speak to my staff. Tell them you want the headache, TMJ, and facial pain evaluation. They'll get you set up for an appointment. You'll be able to come in, sit down and talk with me, and we'll get this process started for you. If I can help you, I'll tell you that. If I can't help you, I'll tell you that too. My name's Dr. Keith Lynch. I look forward to meeting you and working with you.